But there are times when clearly we do need to be concerned about crystalluria. A cat that's previously had urolithiasis, where one of our treatment goals is to undersaturate the urine, if we're monitoring urine in that cat and we find crystals are present, we know that that urine is oversaturated. We're not achieving what we really want to do. So that's a situation where we would be worried about crystalluria. Another situation might be a male cat that's had urethral obstruction, and we'll come back to that in just a few minutes. Good diagnostic imaging is the other crucial part of investigation of cats with lower urinary tract disease. And this is a situation where ultrasonography is, generally speaking, much less useful than good quality radiographs. Radiographs give us a lot more information about lower urinary tract disease. So plain radiographs and contrast radiographs, extremely valuable. And by performing good quality radiography, we can identify things like urolithiasis. We can identify urethral strictures. We can identify filling defects in the bladder that may represent things like transitional cell carcinoma. So urinalysis, good quality radiographs are really the basis for making a diagnosis. Really briefly, 4 clinical cases, similar presenting signs. Chaz, an 11-year-old male neutered domestic short-hair cat, episodic episodes of lower urinary tract disease. Developed urethral obstruction on one occasion, he was catheterized, still developing recurrent episodes of disease. Oliver, 9-year-old male neutered domestic short-hair cat, exactly the same history, recurrent episodes of lower urinary tract disease, again catheterized on one occasion. Progressed to develop persistent clinical signs of dysuria. Eartha was a 5-year-old Havana cat, female neutered Havana cat, that actually developed chronic kidney disease at quite a young age, and then also developed recurrent signs of lower urinary tract disease. And Charlie, 3-year-old male neutered domestic short-hair cat, who developed stranguria, urethral obstruction, stranguria for 36 hours. He was depressed, lethargic, and vomiting. Similar clinical histories, at least with 3 of those cats. But if we do sensible investigations, urinalysis, good quality radiographs, we can usually work out what's going on. Probably can't see this, but this is the radiograph of Chaz, the pneumocystogram of Chaz, and we can see that there are a number of small uroliths present in the bladder. Turned out to be calcium oxalate uroliths with Chaz. With Oliver, probably he had idiopathic cystitis as the underlying cause of his episodes of dysuria, but when he had been catheterized, that resulted in an iatrogenic urethral stricture. We were able to identify that with retrograde urethrophy. So we know now that his persistent clinical signs are due to urethral stricture. Eartha, a cat with chronic kidney disease, when we did urinalysis with her, we were able to find bacteria on urine sediment. We cultured her, she had an E. coli. And Charlie had obstructive uropathy. He had urethral obstruction. So in most cases, we can identify underlying causes or at least exclude the major causes of lower urinary tract disease. If we've identified a specific cause, bacterial cystitis, we can treat appropriately based on culture and sensitivity of the organism. If we've identified something like urethral stricture, we can perform surgery. We can do perineal urethrostomy to relieve that situation. Sometimes it's more complex surgery that's required. If we've identified urolithiasis, we can manage that on a long-term basis with appropriate dietary therapy, and we've talked a lot about that this evening. The only thing I would say, again, to emphasize here is that it's going to always be better to use a tin diet if we can. One of the goals is to undersaturate the urine. We want to encourage as much fluid intake as possible. That is better achieved with a canned diet, a tin diet, than a dry diet. If you have a cat or an owner that is unable or unwilling to feed a tin diet, then certainly choosing a dry diet that has some added salt to help induce that diuresis, to dilute the urine, that is going to be beneficial. But out of preference, we would go for a wet diet. And there was Charlie, that 3-year-old cat with urethral obstruction. I won't go into huge details with him, but he was a typical case of urethral obstruction. Presented with 36 hours of straining to urinate. He was depressed by the time we saw him. He was vomiting. He was quite weak. He was actually bradycardic. His heart rate was 120. Abdomen was quite enlarged. It was painful. We could palpate a very big, very tense bladder. When we did routine bloods, and we actually collected a urine sample from him by cystocentesis as well. When we did routine bloods on him, you can see that he is severely azotemic. Huge urea and creatinine. He is going into acute renal failure. He has a very high potassium level, 7.9 millimoles per litre, getting into that really dangerous range when it gets up to around 8 millimoles per litre, where we know that can be a cause of severe cardiotoxicity. He's got elevated phosphorus, which obviously goes along with the acute renal failure. He's acidemic as well. Urinalysis, he's not producing particularly concentrated urine. We've got a very inflammatory sediment, and we've got some struvite crystals there as well. We know struvite crystals can be a normal finding in cat urine, though. He was bradycardic. He was actually suffering from hyperkalemic changes. When we did an ECG, you can see there are no P waves. He's got atrial standstill, effectively, causing that bradycardia. He's got wide QRS complexes, he's got tall tented T waves, all the typical changes that we can get with severe hyperkalemia. And of course that can be a life-threatening complication in this disease. So obstructive uropathy is something that we all deal with on a regular basis. Causes post-renal azotemia, can progress to renal azotemia, acute renal failure, and can cause death in 2 to 3 days if we don't treat this. And we often get secondary complications associated with it. Variety of underlying causes as well. Variety of underlying causes for urethral obstruction. Probably the majority of cats have a urethral plug, but we can have urolithiasis that causes urethral obstruction, we can have strictures, and we can have simple urethral spasm as well. Sometimes it's a functional obstruction rather than a physical obstruction because the urethral sphincter has gone into severe spasm. So we can get a variety of underlying causes. Most common, though, is probably urethral plugs. This is an electron micrograph. It's not one of my pictures. This is from a publication, I think it was in Vet Clinics in North America several years ago. But it's an electron micrograph through a urethral plug. And you have this mucoprotein matrix that forms the plug. But within that mucoprotein matrix, you have cells and cellular debris that get trapped, and there are crystals as well, usually struvite crystals, that get trapped within that mucoprotein matrix, which forms a kind of glue that keeps everything together, forming that urethral plug. How are we going to go about relieving urethral obstruction? Well, I'll only touch on this very briefly because if you have a method of relieving urethral obstruction that works well for you, keep on doing it. It's one of those situations where there is no golden rule for relieving urethral obstruction. There are lots of different approaches to relieving obstruction. What I would say is one of our most important goals should be to avoid urethral trauma. Always try and minimize trauma to the urethra. So we need to think about the patient that we're dealing with. We need to think about the complications. If there's severe azotemia, we may need to do cystocentesis first, empty the bladder as completely as possible, get some intravenous fluids on board perhaps before sedating or anesthetizing the cat. In other cases, we may see it at a much earlier stage, before there's azotemia. Those cases, we may not need to do that first. One of the first things we might try and do is urethral massage. Now, not if we think that there is a urolith or an accumulation of small uroliths. Don't want to massage the urethra in that situation. That's going to cause trauma to the urethra. But if it's likely to be a soft plug, if there's no evidence of urolithiasis, then urethral massage, just gently extruding the penis, massaging the penile urethra, putting a finger into the rectum, massaging the pelvic urethra to try and gently break down any plug that may be present in the urethra, and then just gently putting pressure on the bladder. That may be sufficient to extrude a urethral plug. Most important thing, though, again, is to do this in a very, very gentle way. The last thing we want to do is traumatize that urethra. If we can't simply relieve the obstruction in that way, we are probably going to need to catheterize the cat. Again, important just to think about how we're going to do that. Using a soft catheter, silicone, polyurethane, PTFE, one of the soft catheters is much better to use in this situation than a hard PVC or polypropylene catheter that is more likely to traumatize the urethra. So a soft catheter. One of the things that we want to do is to try and flush the urethra, try and flush out that obstruction. Again, it's going to be much easier to do that if we've got an open-ended catheter rather than a catheter that has side openings. So just a little bit of thought about the type of catheter that you're going to try and use. And what we'll often, in fact, end up using at